Thank you all for having me. I'm just going to provide a little overview of what I'm going to be talking about today. I've called it Alcohol Use, Where Are We Now? I think all the other speakers are going to be talking in a little bit more detail about fetal alcohol syndrome and fetal alcohol syndrome disorder. So I'm going to talk a little bit more about, I suppose, where we've come with alcohol, our drinking rates, how they compare to Europe, and then specifically looking at women and alcohol and pregnancy. So some of you might be aware of this book, Alcohol, No Ordinary Commodity. And there's a quote in the opening chapter from the Heath book, which is that alcohol can at the same time be a food, a drug, and a highly elaborated cultural artefact with important symbolic meanings. And I think that's a good way to kind of start this, because it is going to run through the presentation of where we place alcohol in our lives. It doesn't have to always form the image that we think it does, the stereotype of someone on a park bench with a bottle in a brown paper bag, that it can be a lot more subtle than this. And certainly from a harm point of view, we need to be very aware of this. From this point of view, I think most people will be agreed that it's best to focus on the WHO guidelines of hazardous, harmful and dependent drinking. And I think when we look at it in this guise, we can actually see a lot more people in society, and probably a lot of the people that you work with, who might fall into these categories. Okay, so some of the impacts of alcohol, and I'm not going to go into too much detail, but I think everyone's aware there's a lot of health and social problems associated with extreme alcohol use, whether it's family problems, employment, education, and then obviously the multitude of health problems. Pretty much affects every single area, every disease area that we can think of, physical, psychological, and is responsible for, like I said, a large proportion of the global disease burden. If we focus specifically on who is drinking, there's a lot of different people with alcohol problems we need to look at. We have adolescent drinking in Ireland. It is improving, but it is still an issue. The college students and young adults. We have young men with unhealthy drinking patterns. We have young women who are a newer group, and certainly a lot more of the areas of liver disease are now being found among young women. We have alcohol and pregnancy, which we're going to talk about today. And obviously we have our elderly population as well, who have certain features of alcohol misuse. Well, I think first of all, one of the things we have to acknowledge is there's been a huge social and cultural change for women in Ireland. Traditionally, women wouldn't have drunk that often and wouldn't have drunk that much. I know my mum said when she was in college, women didn't tend to go to the pub unless they were brought to the pub by somebody. And I think if you said that to college students now, I say to my students, they can't actually believe that. They also don't go to the pub because most of them drink at home. So we see that like a lot of things have changed, but certainly women have a greater place in society, they have more education, they have more employment and more disposable cash. And one of the things that has been noted is Irish women are drinking more often and drinking more on each occasion. They are more vulnerable to problem alcohol use. From a metabolic point of view, they don't metabolize alcohol as easily as men. They also have much smaller body structure. So there are more, I suppose, from a biological point of view, more implications for alcohol with women. There have more recently been a lot of links made to breast cancer. There's a lot of risks to sexual and reproductive health. A lot of the evidence from the Crisis Pregnancy Agency and the study on contraception found that girls and men are far more likely to not use contraception and to have unplanned sex if they have been drinking alcohol. So it plays a big role in that. And then obviously what we're going to be talking about today, which is alcohol and pregnancy. So just thinking a little bit about alcohol and pregnancy, and like I said, I won't go into too much detail on the subject matter because I think I have 4 colleagues who are going to be giving more detailed, but just to kind of give an overview of FASD, FAS and FAE and some of the features. It is an umbrella term. It is directly related to alcohol consumption during pregnancy. It ranges in severity. There's physical, cognitive, behavioural, and I think as well one of the speakers is going to talk about the facial dysmorphisms. For some of you who've worked in substance misuse for a long time, you've probably worked with patients who someone might have said to you, that's a classic fetal alcohol syndrome case. One of the things I have to say straight up is that I'm going to present some data on it, but there's a lot of challenges with measuring this because it's not formally identified in many countries, which has a lot of implications. Most of all, that we don't know the prevalence of it in a lot of countries, but also we won't know how to treat it. So one of the reasons we measure things is to know how we might address it. So it doesn't go away after birth. People are dealing with it for life. So the implications of not identifying and not measuring it are huge. And there is a lot of variety, I suppose there's a lot of variance in terms of what estimates people are coming up with. But certainly some of the evidence so far in the States is kind of ahead on this one because they do measure it. They say 0.2 to 1.5 per 1,000 births. In Europe, the estimates are anywhere between 0.4 and almost 20. So there's obviously a lot to be done on that. just some of the papers, and I won't go into too much detail on it, but the JAMA article certainly looked at the prevalence. This was among young people, and they found that it was much higher, more likely among children in care, more higher among people in lower socioeconomic groups, and higher among people in psychiatric care. Again, with the Lancet article, and this is probably the more recent one that you're all quite familiar with, they found that problem alcohol use during pregnancy was about 10% global, but about 25% Europe. And again, there we see that Ireland is overrepresented quite a lot by about 60% during pregnancy. A group from UCC, with their article in the BMJ, again found that 20 to 80% of women, Irish women, drank during pregnancy, 45% were binge drinking, and smoking was the greatest predictor. So we see a lot of other social factors and behavioural factors that are implicated in it. Again, I won't bore you with too much evidence, but I think it's important to kind of identify what are the things we can associate with it. And certainly the first study found that about a third of women were smoking in the first trimester, or drinking in the first trimester, and then another third drank throughout. Now, it is important to note that the group who drank throughout were low to moderate drinkers, but they were still drinking throughout the entire pregnancy. For those who were continuous drinkers, so the ones who drank through the whole pregnancy, they were more likely to be from affluent groups, more likely to be well educated, and more likely to be in the mid to late 30s. For those, the second study here, the BMJ, was looking at adherence to lifestyle behaviours during pregnancy, and they specifically focused on alcohol, tobacco and folate use, so taking the folic acid pre and during pregnancy. And they found, again, that only 26% were following the guidelines before they got pregnant, and this only rose to 39% during pregnancy. So that's quite a, it's an improvement, so it certainly shows that people are taking advice on board about behaviours when they get pregnant, but it's still not a number that you'd be happy with. You'd be hoping for something higher than that. And low adherence rates were more common among socially disadvantaged groups and women of a much younger age. So we see that there's a lot of social cultural issues at play. Okay, so again, some of the Irish studies, and I won't go into too much detail because I think the others will talk about them. But again, we see that younger ages are associated with heavy drinking and older ages are associated with more continuous but also more affluent. So I think we have a couple of different issues here. You're probably all familiar with the social determinants of health. I think we have two kind of clear patterns emerging. We have low to moderate alcohol use throughout pregnancy with affluent women who are well educated and potentially have access to healthcare services. Certainly some of the Irish studies found that they were more likely to have private health insurance. And they are making a decision, potentially what they feel is an educated decision, that there is no risk to them consuming alcohol for the whole pregnancy. We then have a smaller group who are using alcohol during pregnancy at heavy levels, so which would be directly linked to the risk, having a risk of fetal alcohol syndrome. And they are from socially disadvantaged groups. They tend to be younger and have lower levels of education. So we see that there are a lot of social patterns to this. And I think if we try to understand people's health, we have to look at the social environments that they're in. Certainly education, age and employment are obvious demographic features. But I think there's more subtle nuances in there as well in terms of what's affecting people's decision. And I think, we know that that society, culture, our social groups, family, workplace, colleagues, all of these different things will affect a person's decision on how they manage their health and the decisions they make about their health. You might be familiar with these slides. They're from the Growing Up in Ireland study, so it's a large cohort study, largest of our kind in Ireland. And this is from the cohort of 9-month-olds. So this was interviews conducted with families who had a 9-month-old baby, socially representative of Ireland. And this is looking at smoking and pregnancy. And I'm going to show two slides on alcohol and pregnancy and smoking and pregnancy, because one of the things we found is that the decisions people make around behaviours such as alcohol, tobacco, folate use, breastfeeding, weaning, all these different things that we have very clear evidence on and clear advice on, and yet how people take that advice and how they use it does seem to be influenced by quite a number of factors. And here we see with something such as tobacco use, we see that education plays a very big part in it. So probably too small to see the print, but this column here is lower secondary or less. Then we go on to leaving cert, sub-degree, degree or third level. So we can see that certainly the lower level of education, the higher rates of tobacco use. One of the things that is obvious is there's three different columns, and the first one is looking at, the navy one is some stage during the pregnancy. The green is all trimesters and the purple is just at the time of the interview. So that would have been when the baby was 9 months old. And if we dig down a little bit deeper, you do see that there is a shift between maybe at some stage of the pregnancy and throughout. So for instance, someone might have been smoking, but then they find out they're pregnant, so they stop. Or they get advice that they're pregnant and they shouldn't be smoking, and they stop. So we see that people are taking some advice about changing behaviours during pregnancy from healthcare professionals or friends and family, because there is a shift. But it doesn't shift the curve. The curve is still the same. The curve is still showing that the less educated you are, the more likely you are to continue tobacco use during pregnancy. And then if we look at alcohol in pregnancy, it's a similar curve, but slightly different. Again, there's that changes between at some stage and for all trimesters. But we see that certainly level of education. So the more educated you are, the more likely you are to continue alcohol use during the whole pregnancy. Now, this doesn't say how much alcohol. We don't know whether it's low or high, but it does show about decisions that people make. And again, there is that promising feature that there is a moment or there is a window during pregnancy where we can actually make improvements to people's health. And the final slide from the Growing Up in Ireland looks at breastfeeding, and here we see an interplay of both education and cultural reasons. So if we look at the navy figures, it's women born in Ireland, and we see certainly that those with a lower level of secondary education, only about 20% are breastfeeding, as opposed to women with a degree have about 73% breastfeeding rates. We see huge discrepancy there between mothers' level of education and likelihood of breastfeeding. But then if you look at the green, it's mothers not born in Ireland, and you see the same curve, but just an awful lot higher. So we find that mothers not born in Ireland have 65% rate of breastfeeding, which is almost as high as Irish mothers born in Ireland with higher secondary. So we see that while there's an education curve in both population, Irish mothers and non-Irish mothers, we also see that there's a huge cultural gap as well. So we see that it's not usually one factor on its own, it's usually an interplay of education and culture. And I think that's quite telling. Okay. So if we think of society and family and the other effects that can have, so certainly society doesn't just mean education and salary and income and housing, but it's also, I suppose, the social groups that people are in and what impact that has on people's decisions they make, and specifically decisions they make regarding their health. And we know that society and social acceptance is a big one. And social acceptance of alcohol is something that we do need to address, I think. And these are quotes from a study that I did about the social acceptance of alcohol and how challenging it makes it to change things. So if people are saying, well, should I be not drinking when I'm pregnant? And everybody's saying, sure, everybody drinks when they're pregnant. It's not that big a deal. Sure, didn't your grandmother do it and I did it? And, the social circles that we move in. And if we look at our data about Ireland, and I think even if we, I suppose, are honest, we know that there is a social acceptance of alcohol, both among lay and professionals. And one of the quotes here is from a GP talking about how hard it is to try and get a message across in the context of communities where there's very heavy alcohol use. And again, that idea that it is quite a deceptive drug, and we do have a culture of drinking. And I think with that in mind, if we think of the group who are probably most at risk here, as I mentioned, the younger people from disadvantaged communities, and often people with co-occurring substance misuse issues, and I think, again, that's going to be touched on in later ones. If we take patients or service users who have a history of substance misuse, they are a very complex set of patients, and I think you've probably all worked with people who are in a very vulnerable position. They have high rates of morbidity and mortality. They have very high rates of unmet need. They're often homeless or have insecure housing. They're more likely to have a low quality of life. They suffer an awful lot of stigma, particularly if they're a substance misusing mother. There's often family problems. An issue of a fear of child protection is a very big one. A very high history of sexual and physical abuse among this patient group. And a fear of services and engaging with services. And I think that's very important to remember. That issue of child protection, again, these were two female patients that I worked with substance misuse issues, particularly alcohol use, and talking about that very, very real fear of being a mother with a substance misuse issue and how difficult it is to engage in services for two different reasons. One, being a fear of child protection issues, so being seen as an unfit mother and potentially being at risk of losing their children, but also the other of maybe accessing treatment and how difficult it can be. And we know that women with substance misuse with children are more excluded from services than those without. So an important one to remember. This is a study the colleagues of mine in NUI Galway did at the Health Promotion Research Centre, and it's on weaning. But I think it's interesting because I think there's a lot of similarities between what affects people's decisions they make. And we see that with weaning, and this is obviously moving towards solid foods, which might seem a bit bizarre in talk on fetal alcohol syndrome, but I think it shows the impact that social circles have on people's decisions. So certainly baby books are there, the internet, which we know it can be risky because you can find any information you want on the internet. Grandparents and healthcare professionals. And on the issue of healthcare professionals, they talk about the fact that, well, I listen, but I say yes, but I'm not actually going to do what they're saying. I already know better, and I'm going to do what my mum did. So it gives us an idea, and I think if they're willing to do this, follow this advice for something like weaning, I think that we could probably say there are some similarities for alcohol. Okay, so in conclusion, where are we now? So I think we have moved on a lot from don't have the fifth pint if you're driving. But I think it's important to note that it takes quite a while for evidence to happen. I don't think anyone will quite remember these ads. More doctors smoke Camels than any other, or the Born Gentle. So this was the Philip Morris cigarettes, which were advertised for new mothers because you'll be so relaxed. And it seems bizarre now. But it took a long time to get to where we are now for that. The Dahl and Hill study was published in the 60s, and it was the first strong evidence to link tobacco to premature mortality. And it's still one of the strongest pieces of evidence, and it's a landmark paper. But that was in the 60s, and it took us, we are now, in 2015, we're down to 23% tobacco use and aiming hopefully for a tobacco-free society eventually, but certainly the 2025 target is 5%. And I think it just shows how long it takes. There has to be a cultural shift, there has to be a change in policy. One of the reasons why the tobacco lobby worked, or the whole movement, was a suite of measures. So it was support from government with smoking bans, it was changes in approaches from healthcare professionals, it was a societal shift, it was a cultural shift. And I think, it's never just one magic bullet, and I think, we have to remember that. And I suppose trying to relate to the evidence is very important. I'm going to finish on this slide because I think, for anyone who follows Cochrane reviews, the Cochrane review, the symbol is based on the folic acid study that linked folic acid to prevention of neural tube defects. And now it's fairly commonplace for women who are planning to get pregnant to take folic acid. And can we eventually get to that with problem alcohol use during pregnancy, where if you are planning to get pregnant, much like folic acid, you'll take a preventive approach.